when discussing the Class 4 laser, I feel like we should show you the equipment. So here it is. This is a Class 4 laser by Light Force. This is their 15 watt model. It goes up to 15 penetrating watts, which in terms of laser energy, which is measured in joules. Joules is the accumulated energy that is absorbed into whatever tissue is being treated. For treating larger body parts, hips, lower back, gluteal muscles, larger shoulders, areas where there's heavier musculature and deeper penetration is needed. Certainly, the Class 4 is the right equipment. One of the things that is required, this is FDA approved, but also the FDA requires that if you're going to operate a Class 4 laser, you got to have on the protective glasses. So the therapist and the patient needs to have the glasses on when they're receiving treatment. The treatment should always feel comfortable. It shouldn't feel too hot. The penetration happens, and you can literally feel it deep inside the tissue. It's a comforting feel, comfortable warmth, and it's the settings are all variable to match the body part. And here's one of the things that the Light Cure machine shows us, and that's we can choose a body part. In this example, the knee, and then notice the three-dimensional rotating anatomy, and we can stop that at any point so that we can show the injured part. If we have a patellar tendon, for example, or a medial collateral ligament or a meniscus that we're treating, we could do that. So, and we'll go. Here's the same look at a shoulder. And we can stop it if we're treating a deltoid or tricep muscle. And continuing, there we are back. Let's look at a foot. The nice thing about the laser is that for a long time it was hard to find treatment modalities that could literally stimulate healing and repair. You know, we've made mistakes really in treating athletic injuries and chronic injuries. We've oftentimes utilized anti-inflammatories. Ibuprofen, for example, is commonly used to treat sports injuries, or if this were, let's say, an athlete that had suffered an inversion sprain, we'd be treating the talofibular ligament. And ligament tissue, like all tissue, needs blood supply in order to heal. In your body, as we talked about, if you've looked at our acupuncture videos or some of our other videos that talk about chronic injuries and healing, we want to get that fibroblastic cellular response, and that's one of the things that that laser does the best. Is it stimulates the body's healing repair response, which is fibroblasts and cytokines, and the histamine hormone summons those guys to the job site. So if you think about a construction site, a cone zone, and the guy showing up with their hard hats, that's those cellular players. And when we use ibuprofen, referred to in chemistry circles as a COX-2 inhibitor, cyclooxygenase, if we shut that off with ibuprofen or Celebrex or any of the anti-inflammatories, prednisone, we're stopping the job site. We're keeping the workers off the job site. So that's a mistake. Laser, on the other hand, goes the other direction and literally stimulates a good inflammatory response. And that's confusing to people because, kind of like cholesterol, you hear of cholesterol and you think, oh, all cholesterol is bad. Well, there's HDL cholesterol, which is the good cholesterol, and there's LDL cholesterol, which is bad. And in the healing world, there's good inflammation and bad. The good guys are the healers and repair guys, and so we don't want to shut them off with ibuprofen. We want to stimulate that healing response, whether we do it with dry needling, with acupuncture, whether we do it with laser therapy, or manual deep tissue massage therapy, myofascial release. There are other forms. There's injectable therapies that can stimulate healing. Sometimes we can use homeopathic medicine. you know, the list goes on. You'll hear of things. It's all in the box of regenerative medicine. Regenerative medicine is any modality that stimulates your body's healing and repair response. Some of the things we'll talk about in future videos: Polo Therapy, PRP, platelet-rich plasma, homologous or autologous blood injection. So there's a lot of things to be thinking about, and we're happy if you have questions. Give us a call, and hopefully we can clarify these for you.